If you're bringing your child into the office for the first time, the best thing you can do is help instill the trust that you have in myself and the team we've developed to take optimal care of your child and provide them with great dental health. We recognize that it's not always easy to be a parent and watch your child go through anything that might be perceived as challenging or difficult. And a lot of times dental care, as parents, we may have had our own experiences that weren't the best at the dental office. And so we try to help the parents understand that we're doing things a little bit differently now. We go about things in a little bit different way than we did in dentistry even 10 years ago, let alone 20 or 30 years ago, when some of those parents may have been going through dentistry themselves. So the dentistry's evolved a bit, and I think it continues to evolve. And we actually, here at Weis Dental, we strive to make dentistry better and better. The best thing you can do for your child is to try to remain as neutral as possible. Sometimes the best meaning parent may go overboard to try and make their child feel safe, and they may say words that make them feel uncomfortable or make the child raise a question like, why would you say that? So if you can go into it with just a neutral approach and really put the trust in our team, we know what we're doing, we do it on a daily basis, and we will take great care of your child. I want the kids just to look at me as a friend, a father, someone that's a partner in getting them through any dental visit they may need, help guide them on a path to oral health. Parents should look at me as one of their friends or family members and trust as such, and that we're going to take great care of their kids the same way that we would take care of our own children. And I think that's the blessing, is that most of the folks that work here, we all have children. At least we have either kids or nieces or nephews, and we kind of start the day with that. Like, how would we want our child to be treated? But that's why the parents involved in the initial stages of care, to make sure that we're aligned, we're on the same page, and we understand what the parents' expectations are for the care of their child. If a child's really nervous, that's why we've done additional training, is to help understand where that child is, whether it be their age or their psychosocial development or their anxiety that may lead back to a previous dental appointment and someone who wasn't as adept or trained in treating children. So each child is treated on an individual basis, and those expectations are set with the parent and the doctor and the team. And we come out with a plan that works really well for the child. And we go at a pace that the child can handle. Some 8-year-olds can handle a lot of treatment. Some 8-year-olds can't even barely walk in the door. So we help kind of bridge that gap and come up with a plan that works really well for each child. For the first-time parent and the first-time patient in our office, you will experience a level of dental care that is different and more unique than you've experienced in the past. Your child will be the center of attention. They will be cared for in a manner that they're capable of handling at that visit. For the parent, you'll be an active participant in that. The parent will actually be engaged and be able to show techniques on how to brush, how to floss easier, better. We'll review some simple things like which toothpaste you should use, which toothbrush is the best for your child. So we'll answer a lot of those questions that a lot of the parents have on those first visits. It's recommended by the American Academy of Pediatric Dentistry that your child come and visit a dentist or a pediatric dentist by the age of 1. A lot of times there's not much to do for the child's teeth because the child may only have 4, 6, or 8 teeth at that time. Some kids might not have any teeth at that time. So that gives us an opportunity to help prevent dental decay from starting instead of waiting until it's a problem and then it needs to be treated. In my opinion, we are inundated and overrun with refined sugars and carbohydrates in the American diet. The best thing you can do, the best thing, is to reduce the amount of sugars your child gets. It typically comes in your sugary beverages. When a child's really young and a toddler, it's usually juices. Even milks have sugars that can cause tooth decay. So the more you can use water as your go-to, that's best. If you're going to have a juice or a milk, I say just at mealtime. And definitely, you never want to put your child to bed with a bottle that has, or a sippy cup that has juice in it or anything other than water. If you do end up with your child, your 1-year-old child, in our dental chair, don't expect a lot of dentistry to be performed on your child. A lot of what will happen at those visits is called anticipatory guidance. So what we're doing is we're trying to interview you, the parent, and understand the habits of the child. And if there's something that's off, we can hopefully prevent that, or at least advise you which direction you should head to do the best we can to prevent dental decay.